So Ryan, when was the first day that you got diagnosed with COVID?
I started symptoms April 16th. I was on shift. We had just eaten dinner. We got Thai food. It was the captain's birthday, so we had a piece of cake to celebrate. When we were finished eating, we were in the day room watching TV, and I started to feel like some heart palpitations and like kind of chills. So I thought it was my spicy Thai food. I asked everybody else, anybody else not feeling great? And they were all fine. So I went out to the ambulance, threw a 3-lead on, and had a resting heart rate of about 120. Took my temperature, it was 102.4, I think. And then I got sent home. So it was a Thursday. Friday morning, I was sent for a COVID test. Saturday morning, it was positive. Over those couple days, things got a little bit worse. Started to cough a little bit more. Just having a little bit more trouble breathing, but I tried to stay at home and see what would happen.
So then you were admitted to the hospital, or?
Yep, so Saturday morning my COVID test was resulted as positive. Saturday evening, things got a lot worse. I tried to go for a walk outside in the cold. I didn't think I was going to be able to make it back to my house. I did, but Sunday morning I went to urgent care because I was really struggling then. They said I had COVID, which was related, and then also started developing pneumonia in my left lung. They gave me nebulizer and some other forms of treatment and said, come back if things get worse. So I tried to stay at home as long as I could. Sunday night, I started hearing crackles and things when I was laying down, really kind of struggling, had to try to sleep sitting up. Sunday night to Monday morning, I started to cough up blood. Things just were getting worse. My wife said I should probably go to the hospital. I said, I'll be okay. Throughout Monday, the amount of blood I started to cough up increased. Monday night, I was pretty certain I wasn't going to wake up Tuesday morning, so I was afraid to go to sleep. I thought I was going to die. So Tuesday morning, I drove myself to the hospital and was admitted.
Wow. So what was being in the hospital like?
It was hard to walk across a parking lot to get in and not be out of breath completely. Once I was in there, they started chest x-rays and whatnot, CAT scan, and the pneumonia had gone to both lungs, and at that time it was early in my stay. My lungs were 60% full of COVID and pneumonia. I was moved to COVID isolation floor and put on supplemental oxygen, as well as started the whole gamut of medications.
So while you were at the hospital, do you feel like you were treated any different because you were a COVID patient?
I was. It was still pretty early in the treatment and on how they were going about treating things. I was pretty fortunate that my wife worked in leadership at the hospital, and she's able to come up. Sorry.
That's okay, man. Pause for a second.
And she was able to really stay on the doctors as far as treatment that I was getting and things that they wanted to do. Every day I was in the hospital for the first 6 or 7, things progressively worsened. 100% would have ended up on a ventilator and most likely would have died. Not because of anything the hospital wasn't doing, but they just didn't really know what to do, and that's kind of the path that they went down. So I learned a lot about it in the hospital. I was on, I think, 19 medications in the morning, 14 at night. Pills, shots, both arms ended up purple because of all the IVs and blood draws multiple times a day. At its worst, my lungs were about 70 to 75% full of COVID and pneumonia, and I didn't have enough breath to speak 2 words. Luckily, since she was able to stay on the doctors and stuff, they had me lay prone. That was kind of a newer thing that they were having people do. I had to lay prone for a minimum of 17 hours a day, and I ended up doing that for just shy of 2 months.
That's amazing. How has this impacted your family and home life?
It was real difficult when I was in the hospital because I was there, the 3-year-old at home, and my wife being in leadership at the hospital had to work through everything. When I got sick, they kicked my son out of school because I was sick, so it really left her with a lot of burden on finding somebody to watch him. Other people knew that I was sick as well and didn't want to help because everybody, being unknown, was afraid. They didn't want to be around my son who had potentially been around me. So people that we could normally say, like, hey, do you mind watching him for the day? They didn't want anything to do with it. They were too afraid to help. So really, she was on her own to try to work and take care of him, get their meals together and stuff like that. In the meantime, once I finally was able to leave the hospital, I had to follow up on a lot of things. Part of the COVID damages a lot of internal organs. I had a lot of liver damage. The kidneys started shutting down. It creates a lot of these little blood clots in these organs. At one point I had a heart rate in the 40s in the hospital, and they kind of attributed it to that stuff. A lot of the treatment is a lot of steroids, which takes a toll on other things. So I lost like 30 pounds, pretty much all muscle. So I was just extremely weak and fatigued. So even when I got home, I couldn't really help. I was seeing an infectious disease doctor, a COVID specialist, post-hospital stay, and I had to stay 6 weeks quarantined in a bedroom when I was finally able to get out. So being physically not able to do those things was hard enough, but being quarantined in the bedroom made things even harder for the amount of time. And even after that 6 weeks, people still just were very hesitant to come around. My son was I think they first said he could come back to school about 4 months after I had that stuff. So it took a long time to try to get back to any sort of normalcy.
So how has this impacted your health, and what's your long-term prognosis?
It impacted more things than I would have ever guessed. It attacks muscle, so I lost a lot of muscle. My lung function is still not to where it used to be. Finally was able to pass a pulmonary function test last week, and it's now October, so we're several months out, and I'm finally able to pass a test, which is great. Some of the medications, the steroids and whatnot, and the COVID itself, took a toll on joints and ligaments and stuff like that. I had to bicep tendon surgery. Post, part of that might have been before, but I could have played a role in it. I really, for several months, suffered from like real severe brain fog. Like I cannot remember things that I had no reason not to remember. We went to a birthday party, and people that I had known for 15 years, I don't know their names. I don't know why. I don't just in conversation, I would get lost a lot. I can't find words. That stuff has started to improve, and they don't know what that stuff is from or why that happens. My liver is finally getting back to normal, but it's just taken so many doctor's appointments and follow-ups, and there's so many unknowns that they just don't have answers for things. So where it goes from here, they really have no idea. There may be, they call it like a recurring infection that lays dormant for some time. You know, it's something potentially could be cancer causing in the future. I mean, they just said they have no idea. So physically, it's taken a lot out of me, and mentally as well. Just being down for the count during my hospital stay. At one point, they told me to think about reaching out to the people that I need to say goodbye to, because they weren't sure that I was going to make it till the next day. So it's tough to hear stuff like that. But, you know, slowly but surely, it's getting better.
Yeah. So, you're going to be coming back to work pretty soon?
I hope so. The beginning of December is what I'm shooting for currently. I have a couple more doctor's appointments in the next couple weeks to really determine that. But ideally, yeah, beginning of December, I should be able to come back to duty. And that's just to come back to duty to function well enough to do it. You know, not at the caliber capacity that I was able to do before, but you know, I should be able to hopefully do the job.
So I guess you, after going through this, do you have any advice for other firefighters?
My advice would be to take it seriously. Wear the PPE. There's a lot of debate of whether it makes a big difference or not, and I don't know. I wore the PPE on the calls. I still ended up with it. But if wearing a mask, washing your hands, things like that prevents one person from getting it, whether it be you, a family member, it's certainly worth it. There's a lot of cases that aren't as severe as mine, but you know, when you're laying there and they're telling you that you should probably say goodbye to people, really kind of, you don't want to be in those shoes. So staying a little bit of distance apart, wearing a mask, you know, maybe not for you, but maybe the guy next to you. You know, if you're able to stop that from spreading any further, it's all worth it. People get sick, and it's not just old people, and it's not just people with underlying conditions. Prior to this, I hadn't been to a doctor in years. I had no reason to. I was a healthy guy, no issues. And then it hit me the way that it did, and it was pretty hard. So a lot of people think, oh, I'm young and healthy, I'm good. It might not be the case. You have no idea.
Hey, thanks a lot, Ryan.
You bet, man.